Hello, everyone. Today, we are going to talk about the signs of labor, how to recognize them, and what to do when they happen. Labor is the process your body goes through to prepare for childbirth. It can be divided into 3 stages: the first stage, the second stage, and the third stage. Each stage has different signs and symptoms, and they can vary from person to person. Let's take a look at each stage and what you can expect. The first stage is the longest of the 3 stages. It's actually divided into 2 phases: early labor and active labor. Early labor. During early labor, your cervix dilates and effaces. You'll likely feel mild, irregular contractions. As your cervix begins to open, you might notice a clear pink or slightly bloody discharge from your vagina. This is called the mucus plug, and it's a sign that your cervix is changing. Early labor can last from a few hours to a few days, and it can be hard to tell when it starts. Some things that can help you cope with early labor are: drink plenty of fluids and eat light snacks to keep your energy up. Rest as much as you can, but also move around and change positions to help your baby descend. Try relaxation techniques, such as breathing exercises, meditation, or listening to music. Take a warm bath or shower to ease the discomfort. Call your healthcare provider or doula if you have any questions or concerns. Active labor. During active labor, your contractions become stronger, longer, and more regular. They usually last about 45 to 60 seconds and occur every 3 to 5 minutes. You may also feel pressure or pain in your lower back, abdomen, or pelvis. Your cervix dilates faster, from about 4 to 10 centimeters. Active labor can last from a few hours to a few days, and it's the time to go to the hospital or birth center. Some things that can help you cope with active labor are: continue to drink fluids and eat light snacks, unless your healthcare provider tells you otherwise. Use different positions and movements to help your baby move through the birth canal, such as squatting, rocking, or walking. Try pain relief methods, such as massage, acupressure, or epidural anesthesia if you choose to have one. Have your partner, doula, or nurse support you and encourage you. Focus on your breathing and visualize your baby coming closer to you. The second stage is the shortest and most intense of the 3 stages. It's also known as the pushing stage because this is when you push your baby out. Your contractions become very strong and frequent, and you may feel an urge to bear down. Your healthcare provider will guide you on when and how to push. You may also feel a burning or stretching sensation as your baby's head crowns or emerges from your vagina. This stage can last from a few minutes to a few hours, and it ends with the birth of your baby. Some things that can help you cope with the second stage are: follow your instincts and push when you feel the urge, unless your healthcare provider tells you otherwise. Use different positions and techniques to help your baby come out, such as lying on your side, kneeling, or using a birthing stool. Listen to your healthcare provider's instructions and feedback, and trust your body's ability to birth your baby. Have your partner, doula, or nurse support you and cheer you on. Breathe deeply and relax your pelvic floor muscles between contractions. The third stage is the final and easiest of the 3 stages. It's also known as the placental stage because this is when you deliver the placenta, or the organ that nourished your baby in the womb. Your contractions become weaker and less frequent, and you may feel a slight tug as the placenta detaches from the uterine wall. Your healthcare provider will gently pull on the umbilical cord and massage your uterus to help the placenta come out. This stage can last from a few minutes to a few hours, and it ends with the completion of the delivery. Some things that can help you cope with the third stage are: hold your baby skin to skin and breastfeed if you wish. This can help your uterus contract and reduce bleeding. Enjoy the first moments with your baby and your partner. You did it! Have your healthcare provider check your vital signs and your perineum for any tears or lacerations that may need stitches. Drink plenty of fluids and eat a nutritious meal to replenish your energy and prevent dehydration. Now, here is an interesting fact about labor that you may not know. Labor can be influenced by the moon. Some studies have suggested that there is a slight increase in the number of births during the full moon, possibly due to the gravitational pull of the moon on the amniotic fluid. However, this effect is not very significant, and there are many other factors that affect labor, such as hormones, genetics, and environmental cues. That's all for today's video. I hope you learned something new and useful about the signs of labor. If you liked this video, please give it a thumbs up and subscribe to my channel for more videos like this. Also, feel free to leave a comment below if you have any questions or suggestions for future topics. Thank you for watching and see you next time.